Fractures. Introduction. All fractures require surgery.
Select true or false.
Correct. Depending on how severe the injury is and the ability of the healthcare provider to align the fractured bones, an operation may or may not be necessary. It is normal to have numbness in the fingers when using crutches.
Select true or false.
Correct. This happens if you rest your weight on your armpits rather than your hands. This may lead to permanent nerve damage. It is therefore very important not to rest your weight on your armpits when using crutches. You can expect your arm or leg to be weaker after taking the cast off.
Select true or false.
Correct. Your arm or leg will be weaker after being immobilized, but this is usually reversible with physical therapy. It is normal to have severe pain, numbness, and tingling in the leg or arm after a cast or splint has been put on.
Select true or false.
Correct. Severe pain, numbness, or tingling, weakness of the fingers or toes, and swelling are signs of compression of the blood vessels or nerves. This is also true if the nails are blue or stay pale after being pressed. Loose casts are effective in protecting the fracture.
Select true or false.
Correct. Loose casts are not effective in protecting your leg or arm. Make sure to inform your healthcare provider. You may need a new cast. Blood clots in the legs after the injury are harmless.
Select true or false.
Correct. Blood clots in the legs are very dangerous, even though they are unlikely to happen. The symptoms may include swelling of the leg or increased pain, tenderness, or redness of the leg. Thank you for using Explain.